Okay, so surgeries, primarily arthroscopies, ACL repair, total knee replacements. But are there things that you can do ahead of time if you've got knee pain? What are some of the things besides getting stronger and riding a bike, which I'm a big fan of, a no impact way to strengthen your muscles and get that range of motion? So besides strengthening and doing no impact activities, let's talk about what kinds of injections there are. I'm Robin Robertson, founder of Healthy Knees Coach and international best-selling author. I figure I was born with a crappy pair of knees so that I could help you avoid the mistakes that I made and benefit from the many successes I achieved in my long and sordid knee history. Fast forward past multiple knee surgeries, ultimately with both knees replaced. Plenty of life experience and study into the latest research for knees, and I'm stronger and healthier than I've ever been. I want to help you get there too. I share these lessons with you that will change your knees and probably change your life to give you the strength, stamina, and stability to get back to doing the things that you love. If you suffer from knee pain or want to avoid it altogether, you are in the right place, friend. Let's get started.
As far as injections go, the most common is cortisone.
Right. And tell us how that works. What's the principle?
Well, that's an anti-inflammatory, a very powerful anti-inflammatory that you inject into the knee joint. I don't really like to use prednisone, which is an oral steroid, because it's systemic. Whereas injecting cortisone into the affected joint, most of it stays in the joint.
Right. Okay.
Diabetics may notice, even though we put it into the knee joint, diabetics may notice their blood sugars go up because some of it does escape.
Okay.
And like if I took prednisone orally, my blood sugars would rise. Well, same thing with putting cortisone, which is a synthetic cortisol that our adrenal gland makes. And if you get a lot of that, your blood sugars may go up. So I always warn diabetics, they may need to supplement with a little more insulin or oral medication if they need.
That's good to know.
Yeah, and so the cortisone will work wonders for some people. If your knee is too far gone, you can't modify your activities, you're manual labor and you're just pounding your knee every day in the forest or at a construction site, it may not help. It may not be enough.
And that's just, it's not going to fix any problems in your knee, right? It's just going to block the pain.
Block the pain through suppressing inflammation. And I will say that in osteoarthritis, inflammation tends to be a smaller aspect in osteoarthritis than in rheumatoid arthritis.
Yes.
So those are considered inflammatory arthritis. Psoriatic, people with psoriasis that have arthritis, or inflammatory bowel disease like Crohn's. What's the other one? Crohn's and ulcerative colitis. People like that can have inflammatory joint disease too. And rheumatoid arthritis is the majority of those. Those and gouty arthritis, they're going to respond to cortisone injections better than osteoarthritis. However, osteoarthritis does have an inflammatory phase early on when the cartilage is breaking down and flaking off, and your knee looks like a snow globe.
Yeah, it feels like one.
And it's inflamed. That tends to die out. Like my knees, they've been bone on bone for quite a while, and I don't have much inflammatory pain. And
right, yeah.
It just kind of dies out, and then you have pain usually in the bones from no cushion.
Yeah, it's just that grinding pain.
Yeah.
Oof.
Yeah. So cortisone is the number one. We would wait at least 3 months between injections. We waited 3 months. It does suppress your immune system a little bit in the joint. So if you're going to have a knee replacement, you don't want to have a cortisone shot within 3 months of that operation.
Okay, that's good advice.
Yeah.
So no cortisone within 3 months of a knee surgery,
yeah.
a knee replacement.
Yeah, of a knee replacement, and even knee arthroscopy.
Yeah.
Because your risk of infection after surgery is higher if you've had a cortisone shot within 3 months. Some people even say 4 or 5 months, but the way I practiced, and most of us in Bellingham, it was 3 months.
And people will ask me, and I don't know the answer to this, how often can you have a cortisone shot in your knee, and is there a lifetime cap? Like you shouldn't have more than X?
No, I didn't put a cap. If your knee's already shot, really
There's not big risk.
Yeah. Well, I mean, if somebody has a fairly normal knee, they shouldn't be getting cortisone.
Right.
Say you have moderate arthritis and you're nowhere near getting a knee replacement, you try to minimize how many they get.
Okay.
But there's no set number. It's not like, well, after 3, that's it. I hear people come in and say their doc told them, I can't have more than 1 a year. That's not really true.
All right.
You can have them every 3 months, but you don't want to accelerate the wear, which cortisone will do.
Okay.
Okay, because
And why does it accelerate the wear?
Well, it probably a couple of reasons. One is you're putting in something that takes your pain away, so you're going to be more active.
Right.
That's
that
probably,
was my first thought.
Yeah.
Go run and jump and ski again.
Yeah.
No.
Yeah. So that's the main thing. It's super rare to get an infection from having an injection, but you are going through their skin. And so,
Right.
that certainly would speed up the knee becoming infected. And then the local anesthetic that you mix with the cortisone when you inject that, some local anesthetics are cartilage toxic. Now we use so little, it shouldn't really matter. But
Cartilage toxic.
yeah,
So
toxic cause your cartilage to be damaged.
to break down.
Yeah.
Okay.
So-
I didn't know that.
Yeah. Not many people do, but
That's interesting.
we're aware of. You shouldn't inject a lot of local anesthetic into the knee.
Okay. All right. So there's cortisone.